Morning and happy Valentine's Day. It's time for Daily Dose with Dr. Lazar, and I'm really excited to talk to you today about hypertension. The typical mindset for high blood pressure is that if your blood pressure is higher than 140 over 90, it's 140 over 90 or higher, or if you're diabetic, if it is the numbers will be different depending on the literature you look at. Some say 120 over 70, some say 130 over 70, some say 130 over 80, but you get the idea. If you're diabetic, the numbers are lower because it's hard on your heart for diabetes and blood pressure. But high blood pressure is it's really hard on the body. It's hard on the blood vessels. It's hard on the kidneys. Your body just doesn't work at its best. And that's what we're about. We want it to be best. We want you to reach your full God-given potential. We don't want good enough. We want best for you. And so there are some things you can do. Typical, American healthcare system is, the message is exercise, cut down on salt, which, has its benefits for sure. And then it's also to make sure you are taking a beta blocker. Which is blood pressure medication. Sometimes they'll put you on a water pill as well, a diuretic, to keep your blood pressure lower artificially. So have you experienced, if you take blood pressure medication, have you experienced the phenomenon where you will take the blood pressure medication and your blood pressure goes down, but then in 6 months to a year, your blood pressure starts to go back up, and then you go back to your cardiologist or your primary care provider and they raise the dose. They raise the dose of your prescription. If that's happened to you, what's happening is the medication. So think of your brain sending little keys from your brain to your heart. And in your heart, you've got these little locks. And when the keys go into the locks, it makes the heart pump. Just think of it that way. When you take a beta blocker, it takes those receptor sites, those beta receptor sites, or the keyholes in your heart, and it duct tapes those. So then now the keys come from the brain and they can't get into the lock. And so after a few months, your body says, wait a minute, I'm all about efficiency and balance, and I don't want to waste, I don't want to be wasteful. So if I'm sending all these keys and there aren't any locks for the keys to go in, then I know what I have to do. This is what the body says. I have to create more keyholes. I have to create more holes. So the body creates more beta receptor sites in the heart, and then as the keys go down there, sure enough, now we're efficient. So now all these keys can go in the hole or in the lock, and they can open those up, which is awesome. The problem is it raises your blood pressure again. So then you have to keep upping your dose of beta blockers. In 2007, the Journal of Human Hypertension published an article out of Rush Medical Center in Chicago, where Dr. George Bacris was sending patients to an upper cervical chiropractor in Chicago, and getting the pressure off the brainstem showed in 50 of their patients that it lowers systolic blood pressure, the top number of the blood pressure, lowers it on average 17 points and keeps that down for 8 weeks, which was really, really impressive. So it's not like it just bumps it down and then it comes right back up. So that is a really telling study. Now that was 2007, so that's not new information. That was on Good Morning America. It's on WebMD. It's a very popular study. So if you're experiencing high blood pressure, I would encourage you to, of course, exercise, do 30 minutes of aerobic exercise per day. Of course, keep an eye on the salt intake you're having, for sure. Keep an eye on sugar and carb intake, because that raises insulin levels, and then that messes up the blood vessels, and then you can get blood clots and your cholesterol goes up. And then, so for sure we have to watch what we're eating and exercise. But if your blood pressure is borderline and you're told you need beta blockers, or if you're already taking those, I would really encourage you to either reach out to us and we can find somebody in your area, or just look for upper cervical chiropractor in your area and ask them if they are familiar with the hypertension study and if they can help you by taking pressure off your brainstem. You'll be really glad you did. We believe that we should start with the natural approach in helping your body work the way it's designed to before resorting to drugs and surgery. If you believe that too, then share this video, and we will be back here tomorrow for another Daily Dose with Dr. Lazar. Have a fantastic day. Happy Valentine's Day, and we'll see you tomorrow.